but to say that autism destroys families is so repulsive that if you were to say that about any other condition, you'd have immediate backlash.
Hello, and welcome to Disruptors at Work and Integrated Care Podcast. In today's episode, CGI experts will be focusing on discussing a recent national headline related to individuals with autism spectrum disorders. And we will be sharing professional and personal experiences aimed at setting the record straight on quality of life and care for the neurodivergent population. I'm Cara English, CEO and CAO of Cummings Graduate Institute for Behavioral Health Studies, and I'm a special host for today's episode. And I am lucky to be joined by Dr. Lillian Rocha and Dr. Corey Kennedy. So, Dr. Lillian is the founder and CEO of the Behavior Web, and Dr. Corey Kennedy is the Assistant Clinical Director at Elevate Behavior Services. So each of our expert guests has an extensive background and expertise in treating autism spectrum disorders, along with other cognitive and developmental disabilities, which sets the stage for our conversation. Let's get started. All right, welcome, Dr. Lilly and Dr. Corey. We're happy to have you here today.
Nice to be here.
Thank you. Appreciate
Okay.
the opportunity.
Absolutely. And the first individuals that I thought of when I saw the headlines were, of course, all of you who are doing so much wonderful work and have been doing such wonderful work in terms of integrating care and advancing your level to the doctoral and beyond level of knowledge and expertise in helping this population live the top of their quality in terms of their quality of life, and also making sure that their caregivers have an optimal and improved quality of life. So I'm glad that you're able to join me today. I want to begin with a few facts just to set the stage for our discussion today, beginning with why are we talking about this? What is the headline? What was said? So with our new Department of Health and the United States Department of Health and Human Services Secretary Robert F. Kennedy Jr. said a few things in his press conference that he held on April 16th, 2025. He spoke to a Center for Disease Control and Prevention, or CDC, report that reported that the prevalence of autism has risen to 1 in 31 8-year-olds, which is the latest in a series of reports indicating that the prevalence of autism is increasing. So Kennedy said, and I quote, "Autism destroys families." And he also stated that, quote, "Autism is an individual tragedy as well." So Kennedy stated that many autistic children were, quote, "fully functional" and, quote, "regressed into autism when they were 2 years old." And these are kids who will never pay taxes, they'll never hold a job, they'll never play baseball, they'll never write a poem, they'll never go out on a date. Many of them will never use a toilet unassisted. He also said most cases are now severe, and then stated 25% of the kids who are diagnosed with autism are nonverbal, non-toilet trained, and have other stereotypical features. So medical experts have responded in droves and have also been joined by people on the autism spectrum. And so many of the statements that have been made have focused on the fact that the statements were skewed and inaccurate. And so some of the fact checking that has been done included a 2023 study written by Centers for Disease Control officials and university researchers that found that only 1/4 of individuals on the autism spectrum have severe limitations, leaving 75% not in that population. So contrary to what was indicated. And so many people in that 1/4 also don't have the severe limitations that Kennedy mentioned. And in fact, the vast majority of people on the spectrum do not have those severe challenges. So I'll stop there because those are a lot of facts for us to grapple with as we begin our conversation. But the first thing that I wanted to kind of check in with you about is with the individuals that you work with, is the population that you work with more on the severe spectrum, or do you also see a range of, levels of functioning, levels of symptoms, and what we call the core concerns or the chief complaints that bring people into care or bring their caregivers into care?
You want to
Um,
start, Corey?
yeah, sure. I'll start.
Hmm.
So I am clinic based in Tennessee, and we have a wide range of abilities that we see every day in our clinic. Um, we do see those that have the severity that you're mentioning, and there are some special interest groups right now that are trying to define what that looks like. And right now, the term is profound autism,
Hmm.
right? And that is the 25% that I believe he's referring to. However, we see abilities of all ranges from um, nonverbal to comorbidities to savants almost that
Hmm.
really could do anything that they ever wanted.
Hmm.
To limit the discussion to only that one group feels very hindering to the population as a whole,
Hmm.
and not that we don't need to talk about that population, um, but they're not the only ones that need to be in the spotlight or in the limelight at this time.
Right. Thanks, Corey. How about
Yeah.
you, Lily?
Yeah, I've worked both here in the U.S. and internationally, and
Hmm.
I've worked with a broad population too. I've worked since early intervention all the way to elderly patients, and I've also seen um, spectrum, and
Hmm.
that's the reason why the S is in the name of the
Hmm.
diagnosis. It is a
Hmm.
spectrum, and even those who are so-called more profound do have many abilities,
Hmm.
and even those who are less severe uh, also have many complex needs.
Hmm.
So it's a spectrum. It's a complex disorder. I like to say it's a complex condition. When we
Hmm.
talk about neurodivergence, we talk about a condition rather than a disorder.
Right.
And I think that autism is a complex condition. It has many facets, and people who are non-autistics are used to judging somebody who's autistic based on their needs and
Hmm.
in their context,
Hmm.
instead of looking at the autistic reality, context, preferences, etc.
Hmm. Right. I think one of the things that I've been enjoying lately, and I guess I should take a step back and mention that, in the, near 30 years that I've been a clinician, I've worked with many individuals at the school level as well as at the community level, both parents who have
Mhm.
children of their own, parents who've been diagnosed with autism spectrum disorders, who have children who are neurotypical, as well as parents who are neurotypical who are raising kiddos who've been diagnosed with autism spectrum disorders. And then we have parents who have children who are diagnosed with autism spectrum disorders who realize I see a lot of the things that are going on for my kid in myself. Maybe I was misdiagnosed or missed. And so they then pursue their own diagnosis and find out it well into their adulthood that they also have autism spectrum disorders. So I think it's important for us to acknowledge and normalize the enormous spectrum of functionality as well as the enormous spectrum of when autism is diagnosed. Many individuals now are being diagnosed in adulthood, I think predominantly in thanks to social media, which has allowed individuals with autism spectrum disorder to share their experiences and some of the things that they've had to mask for many years that were not aware in the general public, and that there wasn't a level of acceptance around. And now that we've increased acceptance and awareness, individuals are saying it's more acceptable for me to go and get a diagnosis. But what RFK statements seem to be indicating is that, no one should want an autism diagnosis. So I'll stop there, Lily. It looks like you have something to say.
Yeah, well, people are getting and seeking the diagnosis in adulthood, not just because of social media. There's
Hmm.
also a real change in the diagnostic criteria.
Hmm.
Until DSM-5, you had to be up to 21 years old to receive the diagnostic, you know.
Interesting.
So
Hmm.
after 2013, when we finally have a new DSM, and now you see in the diagnosis criteria, you see current or from history. So
Hmm.
it means that if you are 40-year-old and you have displayed those symptoms and signals, you can get the diagnosis. And until the
Hmm.
DSM-5, you could not. So
Right. That's a really good point. Hmm.
And
therefore, you see a rise in adults, not just fed.
Yeah. Go ahead, Corey.
yeah, I was just going to say, and bringing up to that point, something else that has to be considered is this formal diagnosis was not even in the DSM until the 1980s when they came out with the DSM-3. So there are reports of early infantile autism that go back into the 40s. I believe it was in the early 1900s when the word autism was first coined, and it
Hmm.
was believed to be a more severe form of schizophrenia. But
Right.
up until the 1980s, um, there was no diagnostic criteria for a disorder
Hmm.
titled autism spectrum or autism at the time, not even autism spectrum
Hmm.
disorder. Um,
Yeah.
and so nobody had been diagnosed before the 80s. Um,
Hmm.
and since then, which in the realm of medical talk, it is
Hmm.
more of a recent diagnosis than many other diagnoses that we read about and have researched, right?
Hmm.
There's a ton of research out there on diabetes and how to treat diabetes.
Right.
This is still very new in terms of diagnosing. Um,
Right.
and not only that, it's still very new in research also.
Right. Right. Hmm.
There is not a formal cause that has been pinpointed, um, as he stated. However, we do know uh, that Andrew Wakefield, falsified his information in his study, that
Exactly.
claimed his MMR vaccine was related to um, the cause of autism, and
Yeah. And
because
Corey,
he
let me
falsified.
just
Yeah, go ahead.
go.
Sorry.
I just want to say for our listeners who don't know who Andrew Wakefield is, this is a study that was published over 25 years ago by a gastrointestinal physician who was also a surgeon, who did a study of only 12 participants or only 12 cases. So when RFK states that and has stated in interviews that the research on autism that has debunked the vaccine connection is too narrow, we're talking about an initial study over 25 years ago that was extremely narrow, like to the extent that most researchers and scientists would have not paid much attention to it, or may have said, okay, we'll look at it. But what you're talking about is that Dr. Wakefield, the former Dr. Wakefield, who has since been debarred from medicine, from practicing medicine, because he failed to disclose conflicts of interest. In that specifically, he was being paid as part of an effort to sue a vaccine company. And so that study that he published was actually retracted. And so, just to kind of set the stage for those who don't know about the history, public fear has been waging around this idea of the connection to vaccines for over 25 years. But a lot of people just won't accept that this is a person who was paid, and very specifically motivated personally and by profit to say what he said. So I'm sorry to interrupt there, Corey, but not everybody knows about this. And I feel like I'm
Yeah.
explaining this all the time.
Yeah, not at all. No problem. but yeah, and the point I was making is that he is no longer able to practice medicine. He was completely removed from the medical field as a practitioner because it come to find out he had falsified all of the information that was given.
Mm-hmm.
And so to think that we are still trying to argue that vaccines are a cause is
Mm-hmm.
is very counterproductive. And the fear that has been brought forth just about vaccines from that one false study now makes me nervous to think what does society now believe after these statements that have been made
Right.
so publicly that are also false.
Right. Go ahead, Lily.
I think that one important point for us to consider when we hear a statement saying, "Oh, there's an epidemic of autism," is that when we think of epidemics, we think of organic
Mm-hmm.
conditions. You know that you usually take a pill for, or some antibiotics or something, and this is not the case with
Mm-hmm.
any behavioral health diagnosis.
Right.
When we're dealing with something like autism, depression, ADHD, or whatever the condition is, the diagnostic is purely behavioral. We look
Mm-hmm.
at what the individual is doing, how they're behaving for over time and in specific conditions, and we give a diagnosis.
Mm-hmm.
So there
Mm-hmm.
is no pill that will cure autism, and there is no blood test or any other bodily fluid test that you will
Mm-hmm.
take to identify autism. Is purely behavioral. And to
Mm-hmm.
be behavioral, when we say it's a behavioral diagnosis, it means that somebody needs to be able to look at it and
Mm-hmm.
identify.
Mm-hmm.
So, of course, if we understand the diagnosis better, if the diagnostic manual talks about it differently,
Mm-hmm.
people will be able to identify it more, and
Right.
therefore the numbers will rise. And I
Right.
think that we waste a lot of time thinking about, oh, there's a higher number, or it's an epidemic, when we
Yeah.
need to think and take care and look at what are we doing for the people who are autistic. How
Right.
are we preparing the world so they can participate actively in the world? And
Right.
how is it that we as a society are understanding their needs and
Mm-hmm.
accepting their existence?
Mm-hmm.
Because when we
Mm-hmm.
talk about epidemic, what do you want to do with an epidemic? You want to end it. So is this what
Right.
we want to do with the community?
Right. Yeah. And, Lily, that's such a good point. And Corey, your points as well, because the numbers, going from when the CDC started to track the national rate of autism, it was in 2000. And the rate at that time was reported at about 1 in 150. And here we are at 2025, and we're hearing 1 in 36 or whatever that rate. So if you don't understand epidemiology or science or research, you might think, oh my God, like you said, Lily, there's some epidemic. But the truth of the matter is that we learn about epidemiology in our master's degrees and, even in in our bachelor's degrees, but certainly in our doctoral degrees, that epidemiology has a lot to do with screening and diagnosis. And so as you've both pointed to, the improvements that the advancements in what we've understood about autism have led to pediatricians being able to better look at behaviors and make the connection to risk for autism and the need for a developmental screen, for parents to look at, for school teachers to look at, and for individuals who are involved in kids' lives. We've also seen significant improvements in individuals who are not white being appropriately identified. Before the 1990s, for example, most individuals, most children who were not white were simply called bad kids and punished and, sort of written out or expelled from education instead instead of being appropriately diagnosed. So now that we're seeing better rates of diagnosis and screening, of course, that rate looks like it's higher. Doesn't necessarily mean that suddenly there's more autism. It means that suddenly, or over time, and very gradually in our case, we've become much better at accurately assessing and diagnosing. And like you mentioned, Lily, focusing on what we can do to support individuals to help them live a better quality of life and to help them cope better with many of the comorbidities that they're struggling with as well.
Yes, on that note, when we're talking about co-occurring conditions, not until 2013 a person, an autistic person, could receive the diagnosis of ADHD. So you had
Mm,
to pick one or the other when we
right.
know that these two conditions co-occur very frequently. So then you
Mhm.
can imagine that somebody who would be in the less profound end of the spectrum would most likely receive a diagnosis of ADHD than a diagnosis of autism. And that has changed now. So
And
that
Mhm.
individual now would receive both. Go ahead,
I
Corey.
was just going to say, and I think it was 2014 when they
Yeah.
started allowing the co conditions of genetic disorders and autism. So
Right.
things like co-occurring Fragile X and
Hmm.
autism or genetic deletions. And again, you had
Hmm.
to pick one or the other when now we
Hmm.
know that they can coincide, and they very often do.
Hmm.
To another point, with honing in on, a more proper screening or diagnostic tool, another important thing to think about is before the DSM-5, there were other disorders that are now considered to be under the autism umbrella.
Hmm.
So
Hmm.
pervasive development disorder, um,
Hmm.
not
PDD.
otherwise
Hmm.
specified,
NOS. PDD, NOS. I can't
is
tell you how many kids I saw with PDD,
yeah
NOS
is
as
is now
a
under
school
the autism
therapist.
umbrella.
Yep.
Asperger's is now under the
Hmm.
autism's umbrella. So when you open up and start incorporating other diagnostics into one disorder, then of course you're going to have a larger group that you're looking at than you were before, because now we're not looking at just numbers. If there were 20 of those that were PDD and OS, 40 of those that were Asperger's, well, now you're putting all 60 of those in the autism category, which adds plus 60 to whatever the number was before.
Right.
Exactly.
Right.
Good
Yeah.
point.
So, I want to also mention, we have Dr. Pauline Pablo, who has contributed to our discussion today via email because she wasn't able to be here for the recording. But one of the points that she made was that, caregivers often are looking for cures or, and in fact, we had one of our students is in sub-Saharan Africa, and she wrote her culminating project on the belief that many parents have in that area that is based out of religion, that it is the god is punishing the parent, or that the god is punishing one parent over the other. Oftentimes it's unfortunately blamed on the mother. And so, parents are looking for what can we do? Parents are looking for why is this happening? And because there has been a lot of funding and research that has been directed at debunking this idea, or even trying to confirm this idea that it's vaccines because we vaccinate kiddos. Um, Unfortunately, there hasn't been a lot of funding that has looked at, what are the true causal links. And so you have caregivers in those situations, especially those who don't have access to help and support or even healthcare, who are looking for answers. And when providers aren't able to help caregivers access evidence-based supports, they may turn to pseudoscientific methods or religious methods that may be abusive, that may be incredibly harmful. And so we need to acknowledge the gap in care.
Absolutely. I think there's a large access issue when it comes to services needed for autistic patients, and I
Mhm.
think through the lifespan.
Mhm.
There are a lot of primary care providers that don't even know where to turn a patient to that have
Mhm.
behavioral symptoms of autism, um, and so they're going without resources. And
Hmm.
it's unfortunate now that there have been such publicly made statements that for parents that could grasp onto anything because they're at their wits' end, or they're struggling, you know, just to gravitate towards something that is so harmful is really sad, and it's a sad state for us to be in, and the
Yeah.
population to have heard.
Hmm. Yeah.
Yeah, that is terrible. And the other thing about that, when we look at, we have, like Corey said, a large issue with access, but not only access to support and services and treatment, but also um, access to diagnosis.
Hmm.
So, and then the services come only with the diagnosis.
Right.
Mm-hmm.
And then when we have an emphasis on early intervention services and all the funding goes to early intervention services, those
Mhm.
who only have access to a diagnosis later in childhood or teenage years or even in
Mhm.
adult lives,
Mhm.
they have essentially no funding or
Mhm.
support.
Yeah.
So we need to look also, our research should investigate ways to better support individuals older. We need to look about older lives of
Mhm.
individuals on the spectrum. We know that the conditions that are natural with aging, they may manifest differently in
Mm-hmm.
autism, and we
Right.
may not identify them and be able to treat them like dementia and other things. So,
Mhm.
and they're, because of their behavioral symptoms, they many times an individual on the spectrum is subject to a lot more uh, chronic co-occurring conditions like cardiovascular issues, pulmonary issues, diabetes, not to mention behavioral health conditions. So we need to understand the interplay and interaction of
Yeah.
these co-occurring conditions through the lifespan.
Right.
Mm-hmm.
And you make such a great point that I think is something, unfortunately, that doesn't really even get taught in most of our training programs. I know for me, the little training that I had as a master's level counselor, or even as a doctor of behavioral health, was very focused on school age children,
Hmm.
rather than, individuals living at the adult level, and some of those living in group homes who, whose true adult needs are not diagnosed and not being considered, and a lot of times the identity and personhood of those individuals is not considered because, they're considered intellectually unable of, fully caring for themselves. And so we treat them instead as children forever.
Yes,
Mm-hmm.
and then we forget of very real conditions that happen in adults. Say, for example, cancer screening.
Yeah.
So
Hmm.
every woman is supposed to go for a pap smear annually. How about the autistic woman who has profound autism?
Hmm.
Does she
Hmm.
have access to that?
Right, right. And what are the ethical considerations that are involved with that? So, yeah, one of the things that, Pauline also mentioned, Dr. Pablo also mentioned via email was, sometimes the research, or, even the concern from the talking heads, from the DHHS, or, the politicians, is about a cure for autism. And it really misses the boat, because when we're looking at a holistic approach, as you've mentioned, we need to be looking at the life, the lived experience of the
Mhm.
individual. And again, kind of to get into the individual who is experiencing all of the lived, components of health and life, as well as the people who love them, their family members and their loved ones. What is life like, and what are the limitations that we could maybe make a little less, and how can we instead focus more on providing more holistic care, making sure that, the whole health of the individual is being considered, that the social determinants of health, and the social health of those individuals are being considered.
Yeah, I'm glad you brought up caregivers because they are very often overlooked, but they
Mhm.
need these services too. They need support,
Hmm.
and for those with
Hmm.
profound autism, it doesn't mean that they're not struggling, but they do find their way, and they may struggle through it. But to say that autism destroys families is so repulsive that
Yeah.
if you were to say that about any other condition, you would have immediate backlash.
Yeah.
And
Yeah.
so, I don't know what was expected by making that statement. And I think any parent or caregiver of an autistic person would tell you the exact opposite.
Right. Yeah. Very interesting, isn't it? How very different. And one of the things I've really loved is seeing the response from individuals who have been part of the Love on the Spectrum series on
Yeah.
Netflix, talking about their own, how that statement or how those statements affected them. And how they've just been so completely off base with the idea that they don't want a cure, that they don't feel like they need to be cured, um, and just how harmful the words have been to the neurodiverse community in general.
Well, and if a cure is so important, why are they not looking for cures for other things that have been around for even longer, right? Why not
Hmm.
put emphasis on finding a cure for, say, Down syndrome, right?
Right?
And
Hmm.
we know where it comes from, um, but why not try to cure it? Why is this such a topic right now? I won't know, and not that the efforts that some of these families put forward, is to be commended. I believe it was the wrong stage and the wrong way to do that.
Yep. And I think, one of the key factors that anybody should look at is, when a political statement is being made is where are the advocates and the individuals with the lived experience?
Hmm.
Who's speaking? Is this a purely political, statement? Because not a single autism advocate was included or cited or asked. And it did not seem like any individuals with lived experience were part of that conversation either.
You make a great point when you ask us to reflect on political statement. And one thing that we do know about the autistic condition, it's that services are lifelong and
Hmm.
complex and intense, which means a lot of funding.
Right.
So now, if you to answer your question, Corey, why this attack on the autistic
Hmm.
population? I would venture to speculate that it has to do with funding. Because
Sure.
Yeah.
now, if we have a rise on the diagnosis, we now need to provide services for that population, and that costs a lot of money. And I read, not me, but I say the politics, the
Hmm.
politicians uh, would rather spend that money on something for their own good, perhaps.
Yeah,
Well,
that
and
makes a
I
lot
think
of
it
sense.
was very telling that the statement that RFK made, began with, "These are kids who will never pay taxes." That
Exactly.
hit me like a ton of bricks because all I could think of is, so this from the political administration, the head of the US, that's their primary concern is whether or not these individuals are going to pay taxes, not the quality of their life.
And even if that was a concern, there is no way you can escape taxes. If you go to the corner store and you buy a soda, you pay taxes on that.
Hmm.
So
Hmm.
there is no way you can escape. Perhaps we don't pay the same amount of taxes, but neither do the millionaires. So
Yep. Absolutely. So, well, we are at the end of our discussion here. We've definitely could go on for many days because, we have lots to say and lots of good things to say, and we certainly aim to educate, and share awareness and increase knowledge about this. But I want to thank both of you, and also Dr. Pablo for taking the time to send in your thoughts and to share your expertise because, at the end of the day, if those who are making decisions and writing policy would
mhm,
ask those of us who are expert a little bit more often, I think we would have a whole lot of less waste in terms of funding and cost, and a whole lot better quality of life. So,
Let's
On
keep
that
hoping.
note. All right. Well, if our listeners would like to learn more about each of you, we will be sharing your websites in the show notes. So I want to make a note for folks to look at the show notes so that they can follow up with you if they would like to learn more about your work.
Thank you so much.
Awesome.
It's been a pleasure. I
Yeah.
hope that
Absolutely.
this helps learners to reflect more on this subject.
Okay, on that note, I want to say a big thank you to our incredible guests for sharing their insights and expertise today. If you enjoyed this episode, don't forget to subscribe and share. Let's keep disrupting healthcare together. Until next time.